পেশেন্টরা হচ্ছে অনেক সময় if they wait and they don't go to physician, you might present as a এটার আরেকটা নাম হলো বহুমূত্র, বাংলাদেশে বলে বহুমূত্র। তার মানে you go to bathroom more often. যাদের ডায়াবেটিস সুগার বেশ হাই, ঘন ঘন বাথরুমে যায়, মুখ শুকায় যায় এবং they lose weight. ডায়াবেটিসের রোগী কিভাবে মারা যায়? দেন 60 to 70% of the diabetic patient will have in their lifetime vascular event, like heart attack or stroke. You're a diabetic, your doctor has to do few things. He has to check your blood pressure, of course. I told you the best blood pressure diabetic patient, one best blood pressure is 90 to 110.
আমরা শুরুতেই বলছিলাম যে আসলে ডায়াবেটিস কোনো অসুখ নয়, বরং এটি বহু রোগের উপসর্গ। অথচ আমরা কিন্তু কিছু সিম্পল নিয়ম কানুন মেনে চলেই খুব সহজেই ডায়াবেটিসের মতো একটি ভয়াবহ সিচুয়েশনকে রুখে দিতে পারি। শুরুতে আপনার কাছে জানতে চাইবো যে ডায়াবেটিস, যদি একজন সাধারণ মানুষ ডায়াবেটিস হয়েছে কিনা সেটি তিনি কি করে বুঝতে পারবেন, এবং পেশেন্টের পক্ষ থেকে তার কর্তব্যগুলো কি?
Okay, so how do we diagnose as a physician? How I make a diagnosis, or any physician make diagnosis of diabetes? 3 criteria. একটা হলো আপনার ফাস্টিং সুগার is good enough. If your fasting sugar, meaning আপনার না খাওয়ার পরে 8 থেকে 12 ঘন্টা বাদে যদি আপনি ব্লাড টেস্ট করেন, সুগার দেখেন, it should be ideally, if you have no diabetes, no pre-diabetes, it will be below 100 milligram. আপনি যদি 101 to 125 rather, we call you pre-diabetic. And above 126 milligram যদি হয়, তা আপনার you have a diabetes. আর একটা ক্রাইটেরিয়া হিমোগ্লোবিন A1C. হিমোগ্লোবিন হলো গ্লাইকোলেটেড হিমোগ্লোবিন। আপনার আমাদের সবার মধ্যে হিমোগ্লোবিনের সম্বন্ধে সুগার আছে। If your sugar is high, there will be more concentration of sugar in the hemoglobin. ওইটা আমরা মেজার করি। It should be below 5.6% of your hemoglobin should be concentrated with sugar. If it is 5.7 to 6.4, you are a pre-diabetic. If it goes 6.5% or above, you are a diabetic. তারপরে third criteria হলো on 2 occasions, random sugar above 200 on 2 occasions. যদি হয়, আপনি are a diabetic. তো আগে আমরা করতাম গ্লুকোজ টলারেন্স টেস্ট, which is cumbersome, not needed. So আমরা এখন the criteria for diabetes are these 3. তো আপনি as a patient কিভাবে জানবেন? You should be tested. You should go, if you are above 40, see your physician at least once a year. And আপনার ডাক্তার, it is guideline recommendation হলো যে check them for sugar, check them for lipid, check them for blood. There is a standard. If you go to any doctor's office, they will check your blood sugar, they will check your cholesterol, they will check your height, weight, and they will tell you whether your weight is excess, what should you do. Should be getting a good advice about the diet and exercise, and they will let you know your sugar numbers. Depending on your sugar numbers, they will tell you you're a pre-diabetic or diabetic or normal. So from your perspective, পেশেন্টরা হচ্ছে অনেক সময় if they wait and they don't go to physician, you might present as a এটার আরেকটা নাম হলো বহুমূত্র, বাংলাদেশে বলে বহুমূত্র। তার মানে you go to bathroom more often. যাদের ডায়াবেটিস সুগার বেশ হাই, ঘন ঘন বাথরুমে যায়, মুখ শুকায় যায় এবং they lose weight. ডায়াবেটিস যখন এই 100 বছর আগে এই ইনসুলিনটা আসছে from Canada, insulin was discovered by একটা মেডিকেল স্টুডেন্ট ডাক্তার বেন্টিং এন্ড বেস্ট। 100 বছর আগে এই exactly 100 years ago, Nobel Prize was given in 1943 for diabetes, এই যে হরমোন ইনসুলিন বের করার জন্য। So this is a very interesting story, and you know why the people call diabetes? Hafsa, তুমি জানো কেন ডায়াবেটিস বলে? I did not know. I just was research, and একটা গ্রিক ডাক্তার এটার নাম দিছে ডায়াবেটিস, because going through sugar is going through you, so that's why diabetes means siphoning. So there's your sugar is going through you. That's the name diabetes came. So anyway, diabetes is a systemic disease. Hafsa বলছো যে কারণ it is not just sugar and A1C. No, it does affect everything in your system. From আপনার we call microvascular damage and macrovascular damage. Macrovascular damage হলো stroke and heart attack, আর microvascular হলো চোখ নষ্ট হওয়া এবং কিডনি নষ্ট হওয়া, নিউরো নার্ভ নষ্ট হওয়া। তো আপনার ডায়াবেটিসের রোগী কিভাবে মারা যায়? দেন 60 to 70% of the diabetic patient will have in their lifetime vascular event, like heart attack or stroke. And another 10% will have amputation, 8 to 10% will end up with amputation, and about 30% to 40% of the diabetic people who have significant kidney impairment, and many of them will end up with the end-stage kidney disease, যার জন্য আপনার বাঁচতে হবে, তারপরে আপনাকে you will be on dialysis. দেশে, আমাদের দেশে, সাউথ এশিয়া, স্পেশালি ইন্ডিয়াতে, আমাদের দেশের data is not very reliable in Bangladesh, but Indian data, if we borrow them, then half of the kidney failure, end-stage kidney failure cause হয়েছে ইন্ডিয়াতে poor control of diabetes. Another 30 to 40% is poor control of blood pressure. So, আপনার end-stage kidney is a very expensive proposition. আপনার এখন dialysis আমাদের দেশে আছে, হয়, কিন্তু it's very expensive. আমেরিকাতে per year, on kidney dialysis, cost is over 100,000 per patient, 100,000. And আমাদের দেশে is not as expensive, but it's a very expensive proposition. And আপনার যদি একবার end-stage kidney disease হয়, how long you live? Average 8 to 10 years, unless you are lucky enough to get kidney transplant. So it is a disease can be avoided. How can you avoid? I বললাম আপনাকে, more than half of the kidney failure and kidney কারণ হলো diabetes not treated well. এটা আমরা as a physician we have a clue who will develop that. How do you figure that out? By checking the microbiome in the urine. আপনার যদি urine যদি protein বেশি যায়, you are at a very high risk of end-stage kidney disease. After whether your blood pressure is well treated, আপনার pressure has to be treated. যাদের kidney damage আছে, normal estimated glomerular filtration rate হলো close to 60 and above is we consider normal. Below 60 is abnormal. So between 60 to 30 we call you stage 3, and below 30 to 20 is stage 4, and below 20 is stage stage 5. So you require kidney transplant or kidney replacement therapy. Kidney replacement therapy when it drops, your EGF or estimated glomerular filtration drops below আপনার 12 থেকে 14-15 নেমে যায়. So every year we are all losing kidney function. That's the nature. As we are normally aging, আমাদের kidney function ছিল when I was born, it was 120 cc plus. এখন because every year you lose under 1.5 cc of kidney function every year, and it is worsened or it is enhanced if you lose protein in the urine, or your pressure is uncontrolled, or you have diabetes. এবং if you take non-steroidal anti-inflammatory agents, যাদের kidney function is so, we tell them avoid NSAID. NSAID to alleviate morphine. The biggest, another, this is new. The other cause of kidney failure, especially a country like Bangladesh, India, and South America, যারা খেতে কাজ করে, যে গ্রামে যারা খেতে কাজ করে সকাল থেকে রাত্রি পর্যন্ত, what is there? Extreme heat, extreme humidity, and hard work, and dehydration. They don't have access to drinking water. They don't have any shades. They work all day. And these people exposed in that kind of environment, they have a chronic kidney disease, not reversible. This is, we are finding it, this is a relatively new condition. Actually, it involves a lot of people in poor country who are যাদের আখের খেতে এবং যে ধানের খেতে যারা কাজ করে, they are hugely exposed to humidity, extreme heat, and extreme exhausting work. So এখন we are recognizing them. It is easily fixable. তার মানে আপনি provide them with shades, provide them water, give them enough time to recoup. The body has an immense ability to recoup. But if you are constantly exposing them to extreme dehydration, extreme work, extreme heat, the kidney will take the heat and it is not reversible. So a lot of things that we know. Actually, Jara, those who are experienced physicians, they can tell. Actually, there is a very recent article came in actually diabetes care. Dr. Baccaras, he's a Chicago nephrologist. He is the main author. He actually wrote down who are the people who will be developing kidney failure on diabetes. So it's not the protein in the urine is important. How long you have the duration of diabetes, how soon you have the diabetes diagnosis. Younger you are at more risk of kidney failure because the more duration of disease process acting on your kidneys. There are quite a few, and blood pressure and cholesterol. So actually, আমি সাপ্তাহে বলছিলাম, I was giving a talk in Bardem, যে দেশে about Bardem, Bardem diabetes hospital. I'm a cardiologist. They invited me to talk. I talked. I asked them, what do? They're all concentrated on sugar control, A1C. But A1C doesn't do much. Weighting wise, what is the most important for diabetes? Get their blood pressure under control. What is the best blood pressure for diabetic people? 125 to 130 systolic, upper number. And second best thing is LDL, low density lipoprotein. Normally, average American LDL is 127. Amader kotha holo, for everybody in America, we want everybody's LDL below 100. If you are a diabetic, if you have a disease of the heart disease in your family, like a father, mother, brother, first degree relative has a heart disease, your LDL goal should be below 70. When you are born, newborn babies, LDL is about 35 to 40. So my LDL, I mean, it is 55 years ago, my LDL was 176, 176. So if I did not do anything, I would be in big trouble. Thank God, statin came. You know when statin came? Exactly 31 years ago. This October. 31 years statin came. Statin was a godsend. Statin is a group of drugs like atorvastatin or Lipitor, Castor, rosuvastatin, Mavacor. These drugs have made such a huge impact on heart disease and stroke and diabetes. So I've been taking cholesterol medicine for the last 25 years. So, and I'm happy for that. My LDL is now 41. So newborn baby's LDL is 35 to 40. You can bring it down, change your diet and exercise, and of course, take the medicine. So you're a diabetic, your doctor has to do few things. He has to check your blood pressure, of course. I told you the best blood pressure diabetic patient, best blood pressure is 90 to 110. We are happy if your pressure is below 125, 130, upper number, systolic. After 50, diastolic has very little value. So don't worry about diastolic. Make sure your blood pressure is under control and make sure your LDL is reasonable. I told you for a diabetic, it should be below 70. And other thing, আমাদের দেশি লোকদের triglycerides tend to be high and HDL, good cholesterol, tends to be low. That responds well with exercise and body weight loss. If you read that typical medical book, it says HDL doesn't change. That's not true. I have been in this country for all these years, 55 years. All my brothers and sisters are here. I know all their numbers. Those who are physically active, their HDL is in basically 70s and 80s. If they are not so active, their HDL is about 55 to 60. Those who are inactive, they are 45 or 35 and 7.
নিউ ইয়র্ক থেকে সম্প্রচারিত TBN 24 টেলিভিশন বিশ্বজুড়ে বাঙালির কণ্ঠস্বর।